everybody here. The Personnel Committee, 4 members are present. But nothing was sent to Caleb Fuqua because there was some sort of disagreement going on. So Irvin Brown, Chris Locke, Don Eden, and Bob Hogan. Bob Hogan's here with me. If y'all want, I could just do a brief on the minutes. So everybody knows y'all's minutes are from April the 11th, 2019. Okay. Everybody was present at that meeting except Commissioner Irvin Brown and Caleb. Mr. Bob Hogan at that point was the acting chairman. And basically what we did, and we probably will do today, it said Bob Hogan turned the meeting over to Catherine Lee, the county's medical insurance broker from Hub International. Catherine and her team, Amanda McCall and Michael Lynch, made your PowerPoint presentation about the county's medical insurance renewal. And of course, last year we were looking at some pretty stiff increases, whereas this year our actual claims have come in very well. Y'all explained that the claims have been averaging much higher last year since December 2018. That's not been the case here. Actually, it showed the recommendations that were made last year. There was a attached PowerPoint. And the few things we had on here was where a physician now cost increased to $40, and it had been $38 the year before. The proposed plan design changes, such as the deductibles, the co-payments, and the out-of-pocket maximums, the stop-loss contract option change, the tobacco surcharge stayed at the $15 per pay period, and the high deductible health plan, $600 annual contribution continued. And then we have the Hub International recommendations. It helped drill down the increase to only 2.7 last year. We discussed the wellness, and on the wellness, we were going to require an online health assessment on the Blue Cross website and an actual physical, but with the COVID-19 crisis issue and all that, we've made a change on that because people were apprehensive about going to the doctor. Some people had waited to the last minute. They were going to have until April 30th, 2020. And at the recommendation of Hub International, our broker, we went ahead and extended all of that to next April 30th, 2021. But we still are requiring that they go online and take a personal health assessment. Catherine, get around this. It was by Bob Hogan, seconded by Chris Locke, to accept the offer presented. It's the attached PowerPoint, pages 3 through 9 and page 15 for the county's medical insurance plan effective July 1, 2019, as presented by Catherine Lee and her team. Also, the dental and vision plans were accepted as presented, and last year there was no increase for the county's employees effective July 1, and y'all had voted yay. So basically, that's what the minutes say.
Mr. Chairman?
The mayor's back in here, and so is Chet. So is the chairman. Do y'all want to vote on the minutes to accept, please?
I move that we accept these minutes.
All right, need a second.
Second.
All in favor say aye.
Aye.
Opposed? So moved. Minutes are accepted.
Just a question one time. Who seconded the motion?
Irvin.
Irvin Brown.
Thank you, Irvin.
Okay. So basically, like we did last year, we can go on ahead and turn the meeting over either to Ms. Catherine Lee or Amanda McCall from Hub, and y'all are pretty much well ready to present. I do have Don Eden here, Bob Hogan, Chris Locke, and Irvin Brown, the county mayor. Myself, Jody Stewart, is the finance director. I see Tamika is also online, and our IT director, Chet, is here to make sure everything goes well. And there's a couple other county commissioners in the audience here, Bubba Doris and Bill Moore, Joshua Evans, Keith Hoover are online, and so is Mr. Chad Gregory, and of course the hub team. So we're ready to go if y'all are.
Well, thank you, Jody, and a howdy hello to everyone. I'm sorry we cannot be there in person, but in light of this ever-evolving, rapidly changing social distancing, this is our efforts to keep everyone healthy and safe. So we wish all of you and your family and friends safety and health as well. Know there's a couple of folks that have come in, and I appreciate you being there, and I appreciate those that have dialed in as well. We have prepared a PowerPoint, and I say we, Amanda's going to lead this discussion, and then we've done some pre-work on this with Jody and Tamika, but wanted to, of course, share with you what of our recommendations for your next year is. So with that, I'll let Amanda, if you don't have the PowerPoint in front of you, that's where we're going to spend most of our time. Is that correct, Amanda?
It is. Yep. So if you do have the PowerPoint, we will go ahead and get started on slide 3. And really, we're going to walk through all the benefits, but we'll start with the medical plan. This is usually the longest part of our discussion. So on slide 3, you will see that we have performed an underwriting projection using 12 months of claims experience. We are looking at what we think is going to happen for your upcoming plan year. So based on your claims experience, as Jody alluded to, your claims have run much better during the 2019-2020 plan year than they had previously. So the number you'll see at the bottom is looking much more favorable. I won't go through this underwriting projection line by line. I'm more than happy to answer any questions you might have, but just the concept behind what we do is we use 12 months of claims, and then we project them forward for what we think is going to happen next year. We've made some adjustments to your claims experience to account for the plan design changes that Jody previously mentioned that were made for July 1st of 2019. And then once we find out what we think your claims are going to run for the upcoming plan year, we have to add in your fixed costs. So just to touch on those items, your fixed costs include Blue Cross's administrative fee, the fee that they charge Robertson County to actually process and pay those claims on your behalf. That was initially projected to increase for the upcoming plan year, but we were able to get it to a no change at $44.99 again for the upcoming year. There's a PCORI fee, which is part of the ACA. It was brought back. Originally, it was going to sunset, but they are bringing back the PCORI fee going forward. So we've added in a very small amount for that. One item that you do get to offset the expenses of your benefit plan are rebates from the prescription drugs. So we have estimated what we predict the rebates will be in the upcoming plan year, and you'll see it's quite significant, and that's based on our historical experience. And then we have stop loss charge. So you pay a fee to have reinsurance or insurance for claims that are catastrophic in nature. So any one individual who has a claim in excess of $150,000 would be considered for this stop loss reinsurance, and it protects your plan. And then you also have aggregate coverage in the event that your plan runs 25% worse than we would have expected. So you have two different types of reinsurance that you're paying for. And so we have used your preliminary stop loss renewal here at just under $70 per employee per month as an estimate. So once you add in your claims cost and then your fixed costs, we come up with the plan needing about $930 for the upcoming plan year. I'm sorry, we come up with $873 for the upcoming plan year, but right now your budgetary rate is about $930. So when you look at those two, we're looking at about a 6% reduction from current. So that sounds really good, but I did want to caution you on a few fronts. First is that we've seen March claims and they are higher than what we've had in previous months. So our projection's probably going to be affected by the March claims, which did increase. And second, typically we see the last 3 months of the plan year run about 15% higher than the previous 9 months. You have a lot of members who have hit their deductibles and are starting to really utilize the plan since they're at 100% coverage potentially. So we see a lot of extra utilization typically in the last 3 months. Now, due to the circumstances that we're in right now with the COVID-19, we would say that's probably not expected to happen. As Jody had mentioned, a lot of people are foregoing care right now. A lot of non-essential surgeries are being canceled. So that is going to affect your claims, but we also don't know what the potential impact could be of any members who might contract COVID-19. So there's a lot of unknown at this point that we would want to be conservative and look out for. Are there any questions on the projection that I just went through?
I think we're good.
Okay. All right. Well, on slide 4, I did want to mention some medical plan changes that are being recommended for the upcoming plan year. Now, these medical plan changes are based on changes that Blue Cross Blue Shield of Tennessee is making to their fully insured book of business. We typically look at your self-funded group and see what Blue Cross is doing overall to their fully insured book of business to help manage claims and see if that's something that your plan would like to adopt. So these 8 items are being recommended, and the first one is to remove the visit limit for home health. Studies have shown that home health is actually a more cost-effective side of care, and the outcomes are typically better when the care is provided at home. So Blue Cross, as a insurer, took that home health visit limit off, and we would recommend also doing the same for your plan. Second is Physician Now, and that is the use of telemedicine. Blue Cross, as a fully insured carrier, drastically reduced the copay for their commercial PPO plans for Physician Now or telemedicine, encouraging use of those virtual visits in light of the time taken to go to an actual physician office or other care setting for acute conditions. So we are proposing reducing the copay to $25 for the PPO plan offerings that are offered by Robertson County. So that would be a decrease of what it is today to the $25. Now, we cannot make this change for a high deductible health plan. Before all the COVID-19, it would jeopardize the status of your plan. So we are recommending that this would be for your PPO plan to encourage more utilization of Physician Now. And we looked historically, we are seeing an uptick as we continue to educate about the Physician Now program under your plan.
Quick question. Sorry, this is Chris Locke. I've got a quick question about Physician Now. Are we being charged as a plan for that, or is it simple utilization?
You mean to have this offered
Yes.
under your plan? There is a component in the administrative fee to
For us.
offer that.
Okay,
And then
so
yeah.
something for us to think about, and please correct me where I'm wrong in this. We are seeing the widespread use of telemedicine across the country right now, particularly here in Tennessee. So telemedicine is not going to be every primary care office in the county is going to be using telemedicine. So if we're being charged for a teledoc service, we don't need that anymore, unless there's something I'm not seeing.
Well, typically benefit plans did not allow for telehealth services that were provided, like when a primary care physician was conducting business for telephonically. That
Right.
was an exclusion under the fully insured contracts. That was actually lifted
Right.
in light of COVID-19. So I don't know if this is going to go back into place once all of this goes away. So that would be one caveat.
Yeah, that is something for us to think about, though. So we know this is in place for the next, what? Is it year? Is it year where we know we're good with telehealth being in place now with every office?
No,
Am I
well, we
misspeaking?
have not heard. We have not heard how long telehealth for primary care physicians would be covered under Blue Cross. They're covering it as a provider contract change right now.
Right.
We could
Right.
certainly amend your plan documents to do that. The only thing that you could potentially be taking away is the ability of someone who may not be established with a physician to have telehealth if we eliminated physician now, because it's not, you don't have to be an existing patient of that organization.
I don't think you have to now either. I mean, even with the PCP. So, I mean, you can just establish over the phone at this point with the new regs that have come out here just in the last 3 days. So, am I not correct in that? Because I'm seeing new patients doing telemedicine all day long. I guess here's my concern. Is there a way to amend our plan to where we don't have to pay for this service that's available for free today? And if that goes away via reg, then we can go ahead and start purchasing it again. And if we're talking about $1 a month, tell me to shut up.
It's 40 cents per employee
Okay.
per month.
Never mind.
Yeah, it's very small. And the discounted cost for the services is probably going to be lower than what your network providers are charging as well.
Gotcha.
Because the discounted cost of the plan is $40, and you're collecting
Gotcha.
25 of that in a copay. So
Perfect.
yeah.
Real quick, can you hear me?
Yes. Yes. Was there another comment?
Yeah, I want to ask one question. What is the copay being reduced from to the $25?
Depends on what.
35. Can you hear me?
35. Mm-hmm.
Yes,
Thank you.
35.
Thank you.
Yes. Currently, it matches the PCP copay of 35. Any other questions on number 2?
Chris, those are good questions. I wished I was as sharp as you on this health insurance.
Well, I wish it was saving us more than 40 cents a month. So, you know, it's really a moot point.
Well, I didn't know if it's
Yeah.
$40.
Well, guys, this is Irvin. That's actually $8,000 cost a year based on my projection of the number of employees we have to the county. Because how many employees do we have
You have about 340 on the plan.
in our plan? This is not the school plan, so yeah, it's a lot lower. Okay, never mind. Because the law actually reads that an insurer cannot deny coverage on telehealth care. I just went and looked it up.
Right, and that just changed, correct?
No, it didn't change. It was written into law by Bill Haslam in April of 2014.
I think that was Medicaid, Irvin.
Or is that just Medicaid?
Yeah, I think it's just Medicaid.
Okay, got it.
But commercials are on board today, you know,
Right.
so I don't know, money's money to me, but if we're talking a couple $100 and we can get some people that won't go to the doctor to call, we're better off.
Yeah, no, it is. It's definitely better off.
Mhm. Okay. All right. Well, with that, I will move to number 3. And number 3 was also brought about through some of the ACA changes recently, and Blue Cross is changing so that HbA1c checks are going to be covered as a preventive service without member cost share. So your diabetics, when they are going in to get their HbA1cs checked on a regular basis, can have that covered at 100%. Number 4 is for methadone, and Blue Cross is covering this as both a pharmacy and a medical benefit going forward. And this methadone is for the treatment of opioid addiction. So they're just covering that through the pharmacy and also through the medical portion of the plan if it were, for example, in an inpatient setting. Number 5 is the transplant maximum allowable charge. This was something that Blue Cross did to manage cost for transplants, which can be extremely expensive. So they have removed that maximum allowable charge. So what they are recommending with this change is that for self-insured plans, for example, you ultimately want to have your members going to transplant centers of excellence because you're going to have the best outcomes and the best care. So they recommend covering it at a higher level when your members are using a transplant center of excellence. This wouldn't be for kidney transplants, for example. These are for your heart, your lungs, the major transplants. Covering it at 80% after the deductible if they go to a distinction center, and then 70% after the deductible if they go to just an in-network facility. Both of these things are really optics in my mind because ultimately someone who is having a transplant is going to reach their out-of-pocket maximum. So it's really more of encouraging them to use the centers of excellence. Number 6 is something that has come about as a legislative change. The travel benefit for transplants, there must be a maximum put on it at $50 per person per day. Anything above that reimbursement would be deemed taxable income. So we would need to put that limit in place per person per day for transplant travel. Number 7 is something that Blue Cross recently added. It was actually for 2019. They extended their network for acupuncture coverage and have started covering that as an alternative therapy. And they have built out somewhat of an acupuncture network. There's still a large number of practicing acupuncturists who do not participate in any networks, but Blue Cross has contracted with some. So we have listed here as a recommendation to add coverage for acupuncture. If they utilize a Blue Cross in-network provider, it would be covered the same as therapies. And then number 8 is a new program that Blue Cross offers. And this is called the Diabetes Prevention Program. So this program aims to target individuals who are at high risk of developing diabetes. So they have not yet been diagnosed with that condition, which we know can be chronic and quite expensive, but it's for those people who are high risk for developing. And if you stratify as a member who could potentially develop diabetes in the near future, there is a program to help you. It really focuses at lifestyle and also your weight. So when you enroll in the program, there is a $200 enrollment fee and then a $230 fee for a scale. It's a Bluetooth scale. And so members are encouraged, educated on lifestyle, on diet, nutrition, and they weigh in, and the Bluetooth transmits their weight. Ultimately, the goal is to have a 5% weight loss, which dramatically lowers your risk for developing diabetes. But Robertson County, as a plan sponsor, would pay for the enrollment in the scale, but then they only pay additional cost if the member stays in the program and meets the milestones of the program. So if they met milestones 2 and 3, it would be an additional $145, and then for milestone 4, $165. So you pay that cost as members reach the milestones. So the cost of the program is believed to largely exceed the cost of getting another diabetic member on your plan.
Just sorry, quick question on that. Is that weekly visits for 26 weeks, or what's the plan design on that? The DPP?
No, it is not. It's more of a self-directed course. There are coaches that they will communicate with and nutritionists to help them through the process, but it is not working one-on-one with the physician. It's more of arming them with the tools and the information to make changes within their lifestyle.
So I'm real familiar with the lifestyle change program as it was set across through the state. And my real question is are they going to be doing the meetings with the members of the program weekly, or are they going to do it by phone?
Oh, it would be over the phone. It would not be in person.
It would not be. Okay.
No, and I don't know if you're familiar with Livongo. They used to sell this as an entity. They labeled it and sold it, and they now have worked with Blue Cross to offer this program.
On the meeting needs to mute TV or something.
Yeah,
Thank
I'm not familiar with that exact program, but I'm familiar with the state's lifestyle change program. It's been very, very positive, but you never could get any insurance plans to pay for it. So it's why it died out. So I'm glad to see somebody's got it brought back.
Yeah. Yeah, 2 of the big major insurers are making a big push for this because they see the advantage of catching members before they get to that diabetic state. So this is something that we would recommend implementing. And again, it's something that your members are going to have to opt into the program. They're not going to be forced to do it. But for those people who really want to take action and change the direction that they're headed, it's a great program. So all of these 8 changes that we're recommending, we would not anticipate any major financial impact for making these changes. Some of them might carry a very small additional cost, but given the projection for your benefit plan, we're comfortable adding these in without any change to the cost, the funding rates as they are today. Any other questions?
I think we're good.
Okay. All right. Well, if we're good, then let's go to slide 5. And this talks about your stop loss renewal. And this was what I mentioned when we first started the call. We sometimes call it reinsurance. But what we've shown right here are your preliminary Blue Re proposals. So your stop loss insurance is through Blue Re, which is part of Blue Cross. We did do an RFP and looked at 17 other markets and asked them to quote on Robertson County stop loss. And we found that Blue Re's offerings were the strongest and lowest in premium. So that is what we've shown here. Right now, your specific stop loss deductible, which is that amount that any one individual must meet before being considered for stop loss protection, is $150,000. And then we also added into your plan last year an aggregating specific. So once one or more members have met that $150,000, there is a second aggregating specific deductible of $70,000 that can be met by one or more of those individuals that are over $150,000. And then once that $70,000 additional deductible has been met, your plan is eligible for reimbursement for any of those specific stop loss claimants that exceed the $150,000. So we did this because it was a direct dollar for dollar offset in premium cost to take on that additional risk. And this year you have not had any stop loss claimants. So by putting this in, we really saved $70,000 in fixed costs. So we would definitely encourage you to continue with that aggregating specific deductible. And based on the numbers, we would recommend that you stay with the $150,000 specific deductible level. And your premium, you'll see, increases 10.3% from current. So about a trend increase to keep that the same. We did increase it last year from 125 to 150. And again, that was done for cost reasons primarily, but also you had not increased that level for a while. But when we look at the amount of savings that you get to increase your specific deductible level and how much additional risk you would be taking on, the renewal really looks like the best option. Now, this is one other thing I did want to mention. This is not a firm number here. Typically, stop loss can only be secured at most 90 days out from your renewal date. But we do keep a close eye on all of your large claimants and emerging claimants, and we don't see anything in your data at this point that we anticipate significantly changing or really changing this offer at all.
So 90 days, that actually April 1, and we're going to go effective July 1. So we almost there.
Yes, typically they'll want to see claims through March. So probably by mid-April, we can get a firm stop loss number.
Okay, thanks.
Mm-hmm. Sure. Any other questions? That's really what we have for medical, which would be, we would anticipate because of the unknowns and the historical trending of claims in the fourth quarter, and then making some of these plan design changes, and the fact that we've had one good year, but we've had a couple of bad years, really keeping the medical plan funding rates as is, stop loss level as is, and making those plan design changes. The other thing I didn't mention on our projection, it was written over to the side. You may have seen Blue Cross did offer $15,000 in annual wellness funds for Robertson County to incentivize individuals to participate in wellness activities. So we have that discretionary fund as well if we accept their renewal offer. Okay. Well, if there aren't any other questions on the medical and everyone agrees, I will move on to the dental. The dental is on slide 7, and the dental plan, we did a similar projection. It's much simpler, but we did take 12 months of dental claims, and then we figured out what we anticipate the claims to be. We added in the fixed cost that you have. This is a fully insured plan, but Blue Cross has retention fees in there, taxes that we need to account for. So when we look at 12 months of claims and project what we think the claims will be in the upcoming plan year, we came up with about a 3% increase was warranted. So your dental plan has been running a little bit higher than Blue Cross would like for their fully insured dental contracts to be. And if you look to slide 8, you will see we've been through several efforts with them in an attempt to make this more tolerable. Last year, you had a rate hold. This year, initially, they asked for a 13.4% increase over current, so about $21,000 a year in additional premium. We went back to them and also did a marketing analysis. In the marketing analysis, most carriers were coming in right in line with about that 3% range for 1 year. We only had 2 offers that offered any sort of savings, and it was less than $4,000 total annually. So in light of that, we got Blue Cross to provide 2 improved renewal offers. The first one you'll see is a 3% increase, but it is only a 1-year rate guarantee. So we could be having this conversation potentially again next year. They did offer a second renewal offer, which would coincide with the medical fee offer that they put on the table, which would be a 5% increase to the rates, but it would hold them at the rates shown for the next 3 years. So for
it's 3
someone who,
years. Okay. It says 2 on there, but it is 3 years. Okay, that's what I thought.
it's 3-year rate guarantee, correct?
Good.
So for an individual, it's $1.20 a month increase from what they're paying today. And for a family, you'll see it's about $3.85. So, you know, percentages sound bigger than when you actually break it down to the numbers. But based on this, we would recommend the Blue Cross 3-year rate guarantee. Any questions, thoughts?
Right here.
Okay. Well, vision's even easier than dental. On the vision plan, you will see on slide 10, last year we had a rate hold, and for 2020, they are also offering a renewal rate hold for your vision plan. So no change there. Okay. The next section is going to be the wellness plan. So if you go to slide 12, and I apologize, it should say Robertson County Healthy Living instead of Health Living. So I apologize. I noticed that today. Jody already mentioned this, but in light of what has happened with the coronavirus and a lot of employees being hesitant to go to their physician's office to meet the criteria of getting that annual physical, that number 1 item has been removed for this coming July 1 plan year. We are still asking the Robertson County employees that are on the medical plan to complete the online Blue Cross Personal Health Assessment. It's a series of questions just asking them about their health, their lifestyle, their habits. So for 7/1/2020, they will meet the wellness requirements and get the participation reward if they did take that personal health assessment. So there's a good reason for them to want to do it. If they're in the high deductible, and this was all communicated last year, HDHP enrollees would get the $600 annual HSA contribution by Robertson County if they participated in the wellness program. And the PPO enrollees will pay a lower premium than those who did not meet the wellness program requirements. And I'll show that to you on the next page. We're proposing the same structure with numbers 1 and 2 shown here be continued for the July 1st, 2021 plan year. So on slide 13, this is a visual of what we would do with your premium rates based on wellness participation. So the rates that we've shown here assume that the premiums are held the same as they are today for your plan year. So the budgetary rates, the employee contributions for the HDHP would remain the same. For the PPO, if you participated in the wellness program and took that personal health assessment, you would pay the same rate as you do today. But if you did not complete the personal health assessment, your rate would go up by $50 per month, which is that $600 per year. And that's consistent with the high deductible health plan enrollees who get the $600 HSA money if they participate in the wellness program. If they don't, they do not get the $600 HSA money. So this was communicated as part of enrollment last year. We've had multiple efforts. We've sent out postcards. There are posters all over different areas of the county buildings, just to reiterate what we're asking them to do and why we would like them to take the initiative to understanding where they are today in terms of their health.
Do we know our current rates? I mean, I know we're 3 months behind on claims, but do we know where we are right now?
As far as, well, I looked at it, and because we're eliminating the PCP portion, having them go get their physical, I believe you still have about 200 people that need to take the personal health assessment.
And I'm assuming it's much lower for the full physical, meaning more
Yes.
people need to go get full physicals. Okay.
It wasn't that much more. I was surprised for how easy it is to do the personal health assessment. I was a little surprised. Yeah, I'm going to pull those numbers while we're talking. I sent them to Tamika recently, so I have them available. But any questions about the wellness?
Amanda?
Yes.
On the PHA, those numbers haven't changed. I looked at it today.
Okay. So it's still about 200.
123 is who have taken it.
Right. So you have about 200 that still need to take it. You've got about 330 on the plan. Yep.
Mm-hmm.
Okay.
Okay.
Well, I only had one other thing included in the presentation, and that was the Employee Assistance Program. So if we're ready to move on, I did want to talk about the Employee Assistance Program, or EAP, and that is on slide 15. So the Robertson County does not currently have an Employee Assistance Program. You did previously, several years ago, with Blue Cross, but there is not one in place today. So we have looked at that as an area of potential need for employees. So we did a marketing effort and really narrowed it down to 2 vendors that we liked. There was Aetna and LifeWorks. And so we priced a 3-session model, which is employees and their household members. So it's not just for employees. This is a benefit that would extend to the employee's household as well. And this is a benefit where they have access to counselors 24/7, 365. So there's a triage line that they can call into, and if there's an issue that they are needing to talk to someone about, if they're having marital issues or child raising issues, maybe they're having financial issues, they have a network of providers who are available to provide face-to-face visits up to 3 sessions or 5 sessions per issue per year to help resolve those. So we priced both a 3-session model and a 5-session model. You'll see the price difference isn't huge. But we looked at both of these providers They both have very good reputations. LifeWorks is slightly more expensive. Annually, it's really going to be about a $5,400 cost for the employee to offer this to the employees. And LifeWorks has just a bigger network for the individuals located in Robertson County. So based on our analysis of looking at provider accessibility, the resources that they have included on their website, as well as their collateral that they have to promote the benefit to the employees as well as to supervisors who can refer into the program. We thought that LifeWorks was a really good fit. They do a lot of business with municipalities as well. So we think this is a really value add benefit that you can offer to Robertson County employees. There's more and more focus these days on mental health and holistic approaches to individuals' well-being, and the EAP can play a really big part in that. Were there any questions about the EAP?
So Amanda, then y'all's recommendation would be the LifeWorks with the 3-session model to start?
We would recommend that. We will get aggregate reporting just to see what utilization is. We can get information into the year so that next year when we're having this discussion, maybe we do see the need to increase to a 5-session. 3-session is very typical, and we've seen that because it's per issue, that it's quite adequate to really help members get set on the right path with the issues that they're dealing with. So I think a 3-session model is a good place to start.
And Amanda, just to clarify, the EAP would be offered to all full-time employees, not just to those who are on our medical plan, correct?
Yes, that is what we would recommend, is offering it to all of your full-time employees.
We had that for many years, and then it went away. And put phone number in there for Centerstone, and it's definitely needed. So I'm really happy to see this come back, y'all. Thank you.
And it is for every employee and the members of their household.
Every employee and members of the household.
Isn't that correct, Amanda?
Yes, it is.
I'm gonna say, County, it doesn't have an HR person, it's really a big plus.
Definitely.
Well,
Yeah,
and
it's
employees
something
haven't. So
Go ahead.
sorry, I was just going to say it's also very confidential, so they don't have to come to someone there that they work with or could see. You won't even know who's accessing the EAP. You'll just get aggregate reporting.
Yes, and it's very helpful for things that you can even just think outside of the box. If you need help drafting a will, the EAP has excellent resources. If you have a parent who you're trying to find care for during the day, great resource. Childcare, another good resource. Maybe you're having issues with children, issues with your marriage, more of the typical EAP issues that it's been utilized for. We're just seeing it go above and beyond. Financial health, being able to assist with that. And your supervisors, we would want to be sure to advertise this program to your supervisors and have them refer members in as they see fit.
I had an employee reach out to me 2 weeks ago asking if we had an EAP. So,
I can see a big benefit with all the stress we're having right now.
Especially right now, yes.
Exactly.
Very timely. This would go into effect July 1st, correct?
Yes, that's the assumption that we've made.
Anybody have any questions?
Anybody got any questions?
This is Don. I got a couple of quick questions. Am I on?
Okay,
Yeah.
go ahead.
First off, it's wonderful to have this kind of year where we're having these kinds of discussions. And so I'm very proud of everybody. And it's nice to not have to figure out who's gonna pay for the increase. Number two, what about the smoking cessation? Number one, did we do anything last year? And if we, and we're not bringing it up this year, Jody, you address that first.
As far as I know, that is still something that's in place. They have to fill out a piece of paper that either says they are a smoker or they use some sort of tobacco or they do not. And I think Tamika would be good to answer this. They're doing pretty good on the honor system. You would be surprised at how many have to pay on that, Miss Tamika.
That's right. We complete a form every open enrollment time, and then anytime someone new comes on the plan, all new hires.
So it's still in place,
And
Mr.
so the
Don.
fee, if you're asking about the fee has not changed. It's still $15 if you are a user that is charged bi-weekly.
What happens if you tell a lie to me? Tamika?
That's between you
Well,
and your God.
do they test you or anything?
No, sir. It's totally on an honor system. You complete the form and say yes or no.
Thank you.
Thank you very much.
You smoke.
Yeah, but you got mouth cancer, but probably pay for it.
I'm not okay. Anybody got any more questions? Don, you still there?
Yes, I'm still here. I like it. I think the program is just what we're looking for.
I thought maybe you had another question.
No more questions.
Just as an FYI, I'm doing the bank statement weekly, and I believe the last amount that I saw in the bank was about either 2.5 million or 2.6 million. That's just awesome to see that kind of money. When we first started, I was down to nothing, trying to figure out how I was going to pay a weekly claim. So turned a corner, haven't we, Miss Amanda?
You have. Let's hope that 7 years holds true.
Man, you've done a good job explaining this.
Why, thank you.
Very thorough. Yes, ma'am.
Chris, you got any questions?
No, sir. Not one.
Okay.
So we're going to go on ahead and approve this based upon.
I forgot about Irvin. Irvin, you okay?
Oh,
I'm still here. It's all sounding good.
Okay, good.
so basically, we're needing someone to make a motion and then a second to approve this based upon Amanda's recommendations. She's suggesting on the dental, did y'all say you were thinking we should go with the 5% increase to the 3-year hold?
Yes.
Okay. So if you all are good with all her recommendations as she has listed in the PowerPoint, I think we're ready to move on. There's not going to be any rate increase for any of the county employees.
Okay, I'll entertain a motion.
So moved, Mr. Chairman.
Yeah.
I move we will accept the plan as presented by the folks.
Okay, I got a motion. Bobby Hogan, need a second.
I'll second.
A second by Don Eden. All in favor, say aye.
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 Ah,
Okay, anybody opposed? So moved.
Awesome, y'all. Thank you so very much.
Great news. You're welcome.
Thank y'all very
Our
much.
pleasure.
It's a wonderful thing having
Absolutely.
brokers like Catherine Lee and Amanda and Michael. Y'all do a great job. We appreciate it. Thank you so, so much.
It's insurance what makes our
We
job the
appreciate
best job
y'all.
we can.
Yeah. Good insurance.
Our
right.
pleasure.
All right, y'all. Thank you so much. Yes, we can go ahead and have a motion to.
Hey, before we adjourn, you ladies be sure to wash your hands regularly now in distance here.
No doubt. It's
Hey,
something to
I'm
wash your
telling
hands is
everybody every day, it's a habit. It's in the back of my head.
that's right. It's a term of endearment now when you tell someone to wash your hands.
Yeah. All right, I'll take a motion to adjourn.
So moved.
Motion by Bobby Hogan, second by, Don Eden. You want to second this?
let me talk. Yes, I'll second it.
All right. Everybody in favor say aye.
Aye.
Okay, we
Aye.
are adjourned.
Thank you all so, so much. Even the
Thank you.
we're on the call.
Thank you so much.
Everybody, y'all have a good evening.
Y'all,
Thanks.
y'all take
You
care.
too.